The first thing that I like to do in a consultation is get to know the person and who they are first, right? I don't think the first thing that, I never want to walk in a room and talk to you about what you don't like about yourself or what you're here for. I want to know who you are and kind of the motivation that brings you in the office before we even discuss different, surgical options, non-surgical options. I think understanding where you're coming from is the most important part. And the consultation, it can last a long time sometimes to be able to kind of get to the mutual ground where we understand each other. I want there to be a trust level between me and them. I want to make sure that we're on the same page. And I think that's important to make sure you get able to take that time and get to that point. Yeah, I chose aesthetics because the people, I enjoy the surgeries a lot. You get to establish long-term relationships with people. Sometimes in the beginning they come in for maybe a Botox, or it's preventative Botox or something that they've never done before and they just want to try. And then you kind of explore different things, and as people get more comfortable doing things and see themselves differently and go through the aging process, I like helping be part of people's journeys, working through that. And also I feel like you have a good relationship with patients when within aesthetics that is more meaningful sometimes. And having that relationship with a physician, I think, is really important. That's one of the things that I think, being at a place like L&P Aesthetics, you have the ability to form those relationships with patients. We have something for everybody at every stage of life, from your 20s, 50s, 70s. We have the full spectrum of aesthetic services from different providers, estheticians, nurse injectors, and physicians. And so, we're really a one-stop shop where you can come in for skincare, Botox, fillers, facials, laser treatments, all the way up to surgery. I think treating the whole patient is always important. And even if somebody comes in very specific, like they've been thinking about rhinoplasty or working on their nose since they were 10 years old, if you just look at them as just a nose, then you're not truly doing them justice, you're not doing yourself justice. I think being able to look at somebody from an entire aesthetic point of view is important. I think a lot of people don't feel as well as they can because of something, an insecurity or something that they don't like about themselves, and being able to help them. And sometimes it's as simple as a little filler or skincare, getting them right on the right skincare routine. It doesn't always have to be surgery, but whatever that thing is, finding that insecurity and helping improve that sometimes helps people feel better, and especially in this day and age with mental health and everything, people are trying to be their best selves. Sometimes something as simple as, like I said, Botox or filler can get to that point where they do. Taking care of the whole person is important. A good result is is always going to be when somebody's happy, right? And they're going to be happy and confident with the way they look, and that's the ultimate goal. The ultimate goal is to make sure that they look the way they feel, and they're confident, and they're happy, and that's always what I like to see. And it doesn't always happen at the first post-op or the second post-op. Sometimes that's a couple months down the road when everything's healed. But when we get to that point, it's always a very good feeling for both them and for me. I really resonated towards and chose L&P Aesthetics because of the way they do things here, from a very patient-centered approach, right? I mean, people, you don't come in and try to get sold or pushed towards surgery. Sometimes people come in and they need a little Botox. Sometimes they come in and it's skincare that we focus on. Sometimes people come in and they've been either doing something aesthetic stuff or they're ready for surgery, and for those people, that's the right choice, is to make that jump into surgery. But that's what we're here for. We're here to help guide you and walk you through that.